we will discuss the most common causes of a sore throat, how to identify the underlying cause, and how to treat it with classical medicine, supplements, and home remedies. If we wake up with a sore throat and it is the first symptom we experience, it is almost 90% probable that it is a viral infection. Medically, a sore throat is called pharyngitis. The common cold often starts with a sore throat. After the sore throat, nasal congestion, sneezing, and a mild headache typically follow, along with a mild cough. Low-grade fever and fatigue are also possible. Symptoms usually peak in 2 to 3 days and resolve within 7 to 10 days. The most common cause of the common cold is rhinoviruses. The second most common cause of a sore throat is the flu. Flu and the common cold resemble each other, but flu symptoms occur suddenly and all at once, while the common cold progresses more gradually. In the case of the flu, a sore throat is often associated with fever and severe body aches. Symptoms peak within 3 to 5 days and subside gradually. The third most common cause of a sore throat can be COVID-19, especially the latest Omicron subvariant JN.1. It resembles both the common cold and the flu, but falls somewhere in between in terms of symptoms. For example, it is more common for it to start with a sore throat, but fever is not as common as it is for the flu, yet more common compared to the common cold. Body aches are not as severe as in the flu, but more common than in the common cold. Nasal congestion is possible, but not as prominent as in the common cold. The fourth most common cause of a sore throat can be enterovirus, especially in adults. It looks like the common cold, but with more common body aches and fever. It is also more commonly associated with gastrointestinal symptoms like diarrhea, vomiting, and nausea. Other viruses and bacteria can also cause a sore throat. Streptococcal pharyngitis, strep throat, caused by group A Streptococcus, is a significant cause, especially in children and adolescents. Additionally, viruses like the Epstein-Barr virus, which causes infectious mononucleosis, can cause a sore throat, but they are not the most common causes. A sore throat usually occurs because these viruses infect the cells lining the throat, leading to cell damage and death. The immune system responds to this damage by releasing inflammatory mediators such as cytokines, which increase blood flow and immune cell recruitment to the infected area. The inflammation and increased blood flow cause swelling, which puts pressure on the nerves in the throat, leading to pain and discomfort. Now, let's discuss the most effective treatments for a sore throat. The most commonly used medication for a sore throat is ibuprofen. Its effectiveness is around 7 out of 10. Ibuprofen is a non-steroidal anti-inflammatory drug, NSAID, that reduces inflammation, pain, and fever by inhibiting cyclooxygenase enzymes, which are involved in the production of prostaglandins. These prostaglandins are key mediators of inflammation, pain, and fever. Acetaminophen is the second most commonly used medication but is less effective, around 6 out of 10. It is useful for those who are unable to take ibuprofen or aspirin. Acetaminophen works by inhibiting the production of prostaglandins in the brain, which helps reduce pain and fever. It does not have significant anti-inflammatory properties. Lozenges are commonly used, especially those containing bentocaine or menthol. Bentocaine acts as a local anesthetic to numb the throat, while menthol provides a cooling sensation and helps relieve irritation. Some lozenges contain flurbiprofen, which is anti-inflammatory and very effective, but is not recommended for people with gastric ulcers. Benzidamine is commonly used as well. This is a non-steroidal anti-inflammatory drug, NSAID, with local anesthetic properties that reduce inflammation and pain in the throat. Chlorhexidine is an antiseptic with broad-spectrum antimicrobial activity that helps to kill or inhibit the growth of bacteria, viruses, and fungi in the mouth and throat. From supplements and food, honey is considered effective. It coats the throat, providing soothing relief, and has antimicrobial properties. Honey can be taken alone or mixed with warm water or tea. Vitamin C boosts the immune system, reduces the duration and severity of colds, and acts as an antioxidant. It is often taken at the onset of cold symptoms to shorten the duration and alleviate a sore throat. Zinc lozenges also reduce the duration of a cold by inhibiting the replication of viruses in the throat and nose. Taking them every few hours at the first signs of a cold is effective. Zinc supplements are also effective, but zinc lozenges are more effective for a sore throat. Echinacea is another supplement that is believed to boost the immune system and has anti-inflammatory action. It can be taken as brewed dried echinacea leaves, flowers, or roots, or as supplement capsules. Hydration is crucial. Drinking plenty of fluids keeps the throat moist and helps the immune system function efficiently. Humidifiers add moisture to the air, which can help soothe a dry, sore throat. They are especially important if people breathe through their mouths while sleeping, bypassing the natural humidification and filtration that occurs in the nose, leading to a dry and irritated throat. A warm salt water gargle helps reduce swelling and discomfort. To prepare, dissolve 1/2 to 3/4 teaspoon of salt in 8 ounces of warm water. Make sure the water is not too hot to avoid burning your throat. Take a mouthful of the solution and gargle for 15 to 30 seconds. Tilt your head back slightly and gargle in the back of your throat without swallowing the solution. Spit out the solution after gargling. If a sore throat is not resolved within 2 weeks, it is called prolonged or chronic sore throat. Common causes of chronic sore throat are gastroesophageal reflux disease, postnasal drip syndrome, and bacterial tonsillitis.